Good afternoon, everyone. Thanks for joining. My name is Michelle McGrath, and I'm working with Animal Health Ireland. Again, thanks to everyone for joining. And this is our second webinar that we've done of these. And it's just kind of in conjunction with the series of CalfCare events that we've had there over the last month. We're very fortunate today to be joined by a super panel. And each of those panel will give a short presentation of about 10 minutes, and then we'll follow up with a Q&A session. So I guess just some housekeeping before we kick off. We're recording the webinar, so you're all have to be muted. But if you do have a question, then you can type it in the Q&A or the chat if you're on a desktop. But if you're on a phone, it's generally only the chat option works. So just be aware of that. We are anticipating a lot of questions, and we'll try and get through them all. But I guess we're trying to keep this to an hour. So if we don't get to all your questions, there will be a follow-up email which will give links to any resources that are mentioned today, and we'll also have a Q&A question leaflet as well. So some of the resources that we will mention, again, they're all on our website, but just to help you navigate directly to them. In particular, our new CalfCare booklet that we have just launched, and it's the idea behind it is for busy people like yourselves to kind of give a practical blueprint of the key milestones during the first year of the calf's life. So, and it was put together by Catherine and the TWG. So we're delighted to have that available, and with thanks to Volac Feed for Growth as well with their support for getting that out. So I won't delay too long. I'll just introduce each of the speakers briefly before I hand over to them, and also just to thank Jenny O'Rourke and Oisin Morgan in the background there, keeping everything running very smoothly. It all seems effortless, but that's because they're there in the background. So thanks again to them. So on the panel today, we have John Mee, who doesn't need much of an introduction, I imagine, a well-known vet from Moorepark, specialising in all things calves. We've got Emer Kennedy from Moorepark also, who's done a lot of research on calves and all areas of calf management. We've Liam Gannon, who's from Volac and Feed for Growth, and Catherine McAloon, who's from UCD Vet College, and each will go through a certain area. So we've John doing the first golden hour, as you can see. Emer will follow on then with taking you through the feeding of the calf during that first few weeks, and Liam will take over then, trying to manage the calf around weaning, and Catherine will kind of sum it all up, and with a focus on scour and pneumonia investigations, or what to do in outbreaks of these situations. So again, I encourage you all to ask questions if you have any, and to make it as the more questions we have, the better. And this is your opportunity to get any kind of last minute queries you have out of your way. So John, I'll hand it over to you.
Thank you very much, Michelle. And I'd like to thank AHI for the opportunity to share some information with farmers today. The golden hour is the first hour after a traumatic event in which paramedics have a golden opportunity to administer life-saving care. And we use that analogy in farming for the calf that has just gone through a traumatic birth, and the farmer has a golden hour in which to shape the future of that calf. And it's in that hour that critical factors change and the farmer can decide the outcome. So specifically, this is a time when the farmer can make a rapid assessment of a problem and intervene rapidly. By that, I mean he or she can assess the calf at birth, they can initiate resuscitation, and they can provide newborn calf care. And because we have Emer obviously dealing with colostrum today, it's one aspect I won't deal with, but it is critical in this time period also. So we'll start with assessing the calf at birth. So this is the newborn calf straight out of the cow. It can be assessed as soon as it's born. So if we look at this simple table, these are all the aspects on the left-hand side that any farmer can assess without any equipment and on the right are the signs that there's poor vitality in the calf. So if the calf is born with very irregular or abnormal breathing, then that's not a sign of good vitality. If its gums are extremely pale or extremely purple, that's not good. It's got very flaccid muscle tone. If it's very inactive, that's bad. If it won't respond to a tongue pinch, or when you pull its tongue, it won't pull it back in, or a very poor suck reflex, they're really not good either. And if the calf spends too long lying on its side, and by too long, I mean more than 5 minutes after normal, easy calving, that's not good. So this is the calf, the newborn calf. We can assess it immediately. It's born. This is a good sign. This calf has got its head up. It should do that within 5 minutes of being born, and it should suck your finger immediately after birth. So assessing the calf is easy to do. But in some cases, we will need to resuscitate the calf. And if we have to, this is the basic principles. They're the exact same as in human medicine. Clear the airway, provide breathing support, and if needed, circulatory support. Essentially, any calf that survives to 5 minutes after birth will probably survive thereafter. The majority of calves that die around birth die before, during, or within 5 minutes. So if you get them to that critical 5, they'll probably make it. I make this comment because it's really important. Once you jack, you won't go back. So the decision you make when you see a calf in a cow will determine what happens thereafter. So you have one point at which there's a fork in the road. Either you decided to jack, or you decide to wait, or you decide to call your vet. Because if it goes wrong, you may go into a spiral of panicked resuscitation, which can end well, but can end badly. So that one decision is critical. So let's start with clearing the airway. This is quite simple. So the first point to note is that if we were never at the calving, the fluids in the calf's lungs will either be resorbed back into the lungs or expelled during a normal calving. We don't have to do this for every calf. But there are some calves born that their membranes are still covering the head. We may call it born in the bag. So we need to remove that. You won't remove it unless you're at the calving. So being present is important, and that's simply taking the cleaning off the calf's head. Then manually clearing fluid from the nose or mouth. You'll clear very little fluid out, but you will stimulate the nasal receptors that will stimulate breathing. So it's a good thing to do. We can also aspirate fluid from the mouth or nostrils. That means suck it out. So you have these calf resuscitator devices, and they're very effective at doing that and quite effective at improving breathing. And of course, another common way is to suspend the calf to facilitate the drainage of the fluid. So this is an example of how you might do that. More detail on calf suspension, very briefly. A minute is actually quite a long time. Atraumatically, both for you as the farmer and for the calf you're trying to assist. This does remove lung fluid. This does improve gas exchange, but it's only required for abnormal calvings. Remember, I said that the fluid is expelled in normal calvings naturally. The abnormal calvings, number one, are section calves, calves coming backwards, second twins, and calves with heads down. All of these cases will benefit from calf suspension. Normal calvings don't require it. Then to support the breathing of the calf, once the airway has been cleared, simple methods of resuscitation, I've just picked some of them here. You'll know them quite well. Nasal stimulation. This induces a gasp reflex in the calf using your finger or a piece of straw, or some of you will be familiar with the acupuncture point on the muzzle of the calf. Using cold water, this again induces a gasp reflex. It's called the cold water shock response, and that does improve gas exchange in the calf as well. And simply pouring cold water over the ear or the head of the calf. These are traditional but effective techniques. But more important than either of them is placing the calf in the dog sitting or recovery position. This prevents the pool of blood in the lower lung And by doing so, preventing that, you improve the gas exchange in the calf. So every wet newborn calf, whether it's after a section or an assisted delivery or natural delivery, should be put in this sitting position, not left lying on its side. So administering CPR is very similar to what we would do with humans. So it's cardiac stimulation. So this is the calf that's born, it's not breathing, and if you know where to find the heartbeat, you can't find it, or it's very slow, or you just can't detect it, and you think the calf may already be dead. So if that's the case, you have very little to lose. So CPR is simple. You push hard, you push fast. The heart rate in a newborn calf is much, much higher than you might have thought, and you push deep. And you continue to do so as long as the heartbeat is felt. So again, quite a simple technique. In addition to those immediate procedures, depending upon the weather we'll have this spring, and we always remember 2018, when we had extremely cold weather, we may need to provide warmth. The traditional method of hanging an infrared light over a calf in a box it essentially appears to heat the calf, but really doesn't. It doesn't contain the heat. So if we borrow from countries that have much more experience of dealing with extremely cold conditions, such as North America, this would be a standard procedure. It's called hot boxing. Basically using something like an IBC, sticking a fan heater in it, and retaining the heat inside with the calf. And there are studies showing the benefits, as you'd expect, to warming calves and drying off calves after birth, that they've better vitality, that they'll suck more bee stings for you, and their immunity will be better. So for particular calves, benefits to warming. Then there will be calves after birth that won't suck, not all, but some. And some of these will perhaps be surprising. They won't have been difficult calvings, they won't have been big calves, they may even be small, and they're often section calves. So they're lethargic, they don't suck, and these are what we call dummy calves, and we've the equivalent problem with foals, and those of you that have foals at home will know about the dummy foal syndrome, and it's the exact same in calves. So there is a technique that can be quite successful with these type of calves called chest compression. And for those of you that are interested in it, I suggest discuss it with your local veterinary practitioner who can explain the detail of the technique to you. So finally, a look at navel ill. This is a risk candidate for navel ill, a calf born in the dry cow house where most of our pregnant cows are at this time of the year, but where they shouldn't be calved. And navel ills can progress quite badly before we detect them because we don't generally handle the navel. And it can go from the navel to the joints, so we can get joint ill or liver abscesses or peritonitis, so it can kill cows. So what can we do to prevent navel ill? I've used the acronym AHI, antisepsis, hygiene, and immunity. So if we start with antisepsis, do it early and repeat as necessary. Regarding hygiene, calve in the maternity pen, and if it's a maternity pen, a pen with clean bedding, which is very easy to do on the 28th of January, perhaps more difficult on the 28th of February when everybody's too busy. Remove the calf from dirty calving pens quickly. So this is the principle of snatch calving. So if it's not possible to keep pens clean for various reasons, then don't leave the calf in there. And critically, provide immunity. So you'll hear all about the colostrum 1, 2, 3 rule. It's as relevant for navel ill as it is for scour. So there are many ways you can apply antisepsis. It could be dipping or spraying. We don't have great data for calves, but data in other species such as lambs show that it's more beneficial to dip than to spray. And from first principles, I would suggest that we should be dipping, despite the fact that I feel that most farmers are spraying. So if we look at basic principles of navel care recommendations, if we've got two farmers, farmer A and B, that have navel ill problems, and farmer A is using CalfCare, but farmer B is not, It would be advisable that farmer A that's using CalfCare should modify what they're doing or stop doing it because they've got navel ill problems. Whereas farmer B, who has no CalfCare and has navel ill problems, would be advised to attempt to do some CalfCare. On the other hand, farmers C and D, neither of them have got any navel ill problems. One of them is using CalfCare, and one of them doesn't use any CalfCare. For the farmers using the CalfCare, it would be advisable to continue what they're doing. And unless management changes on the other farmer that's using no CalfCare, they'd also be advised to continue what they're doing. So in summary, most of the information that I've provided here has been provided previously in the Calving and Care of the Newborn Calf leaflet that's available on the AHI website. And some of the takeaway tips I would take from today would be that any farmer can assess a calf before, during, and after its birth to decide whether, if, and when it needs to do something with it. I've given a warning about jacking in haste and repenting at leisure, care needed. I've suggested using a simple ABC to resuscitate calves, doesn't require expensive equipment and is simple to do. And I've also suggested that we use antisepsis, hygiene, and immunity to prevent navel ill. I concluded that. Thank you, Michelle.
Thanks, John. And that was brilliant overview. I have a few questions I want to ask, but we'll hold all questions until the end anyway, and we'll hand over to Emer when she's ready to go there. I was going to ask, should you always put them sitting up then, and you answered it yourself as you went on anyway. It's good to re-emphasize the importance of that to give both lungs a chance of breathing properly. Yep. So I think Emer is ready to go, so we won't delay, and we'll come back to the questions after Emer. Thanks, Emer.
Okay, thanks, Michelle, and thanks to AHI for the opportunity again to speak here. So I'm going to go through some colostrum management. And when we talk about colostrum management, what we want to know is what do we want to achieve in terms of our colostrum management, and why do we want to achieve it? So with colostrum management, it's about achieving adequate passive transfer. So basically ensuring that our calves have absorbed enough antibodies from colostrum. So the three key factors that are going to affect your adequate passive transfer are the quality of colostrum that's given to the calves, the timing of feeding of that colostrum, and the volume of the colostrum that's fed. And it's amazing to think that how you treat that calf and what you feed it in the very first few hours of life has big knock-on consequences for their lifetime. Poor colostrum management can result in a delayed time to first calving, it can result in reduced average daily gain, and it can result in decreased milk and fat production during first lactation. So all in all, what we're looking at is if we don't get the colostrum management right, there's going to be reduced long-term performance, reduced feed efficiency and growth rates. So it's well worth that time making sure that you get the colostrum management right within the first few hours. So what is colostrum? Well, colostrum is the first milk that the cow produces after she calves. And it contains many important substances that are important for calf health. So it's kind of like a superfood for calves in that it's got really high levels of energy, really high levels of vitamins and minerals, growth factors, and these all important immunoglobulins are antibodies, which is going to give immunity to the calf. And why is colostrum so important? Well, if we think of a human baby when it's in utero, there's transfer of antibodies between the mother and the baby. So when we're born, we have more of a developed immune system than a calf. Because when a calf is in utero, there's no transfer of antibodies between the cow and the calf. The placenta is essentially acting as a barrier between the maternal and fetal blood supplies. So that means that the calf is almost entirely dependent on the absorption of the immunoglobulins or antibodies from colostrum. But you can imagine if we think back to COVID, we had no immunity, so we all had to isolate. But our calf is kind of essentially being born the same way. And John said that, hygiene of calving pens is critical. Again, you can imagine when that calf has an undeveloped immune system, being born into a dirty environment is immediately going to place it at high risk. So a question we often get asked is, what factors affect colostrum quality? Lactation number often comes up, and people sometimes think that heifers may not have as good a quality colostrum as more mature cows. But what we have found is that heifers, they are above that threshold 50 milligrams per mil, which signifies like high quality colostrum. The biggest issue with the heifers is the volume that they produce, that they may not produce enough of a volume to feed to the calf for their first feed. That said, the older cows will also have more immunity built up to diseases that are specific to your farm as well. But lactation number essentially is not that big of an issue. One of the key things to remember for the spring is the time interval from calving. So once you go 9 hours after calving, the quality of the colostrum tends to reduce. And that's just basically because the cow has started to produce more milk and is diluting down the antibodies. And the practical relevance or significance here is that you have a cow that calves, maybe we'll say at 7 o'clock in the evening, and you don't milk her again until 8 o'clock the next morning. The probability is that that colostrum won't have enough antibodies in it to feed to the calf for its first feed, that the quality won't be high enough compared to, say, a cow that calved at 7 o'clock in the morning and was milked an hour later. So that's just something to watch out for. In some of the studies that we've done, what we've also found is that the late calvers, so those April, May calvers, they tend to have reduced colostrum quality also. And perhaps that's because they've been indoors in a silage-based diet for a longer period of time. Breed can have a significant effect on colostrum quality. So like purebred Jerseys tend to have higher quality colostrum than Holstein Friesians. And of course, pre-calving nutrition and condition score also contributed to making sure you've good quality colostrum at calving, and the volume of colostrum that's produced. So if you have cows that produce a higher volume, it generally tends to be lower quality. Again, just a dilution effect. So if we ask the question again, what's the quality of colostrum on commercial farms around the country? So 50 milligrams per mil is our threshold. And what we saw in this study was that the average was 84. So generally high quality colostrum in our dairy herds, but a big range across all the herds. And what we found was that 22% of the samples were below that threshold, and that wasn't confined to 1 or 2 farms, it was over half the farms. And this is where we just asked the farmers to submit 5 random colostrum samples from their herd. So what it's telling us is that there's a large variation within herds and that we really need to test colostrum before we feed. So you can easily test your colostrum by using a refractometer. So you just place a few drops of the colostrum onto it. You look through the eyepiece, and what you're looking to see is how far up the white is coming. And once that's over 22%, that's basically saying that, you know, it's high enough quality colostrum that's suitable to feed to calves for their first feed. So how soon do you need to feed the colostrum? Well, as soon as possible. So immunoglobulin or antibody transfer is optimal within the first 2 hours after birth, and then it declines rapidly, and the gut closes after 24 hours. And studies have shown that calves that are fed a higher have higher IgG absorption than those fed later when there's similar concentrations and volumes of colostrum are fed. So, and the volume that you should feed should be at least 3 litres. So this is giving us our colostrum 1, 2, 3 rule. So first milking, feed it within 2 hours of birth, and to feed at least 3 litres. Again, another question that often comes up is, how should you store colostrum? Well, one of the biggest things to consider is hygiene. So you need to make sure that you're collecting your colostrum in really clean equipment. So any of the churns or that you're using are spotlessly clean. And when we've gone out in farms and tested the hygiene of some of the feeding equipment, the dirtiest piece of feeding equipment that we found on farm have been the stomach tube and the bottle and teat. You know, and they're the first things that you're using to feed the calf its colostrum. So immediately, again, putting the calf at a disadvantage. So make sure everything is kept nice and clean. And if you're storing your colostrum, you need to refrigerate or freeze it within 3 hours of collection so that you will arrest the bacterial growth in it. And if we're storing it in a fridge, it will last for 48 hours, and in a freezer, it will last for a year. Colostrum should always be fed warm. So if you're taking it out of the fridge or the freezer, warm it up, but be careful when you're heating it. You don't want to denature, kill off all those antibodies in the colostrum. So just heat it up to body temperature. So How does colostrum quality change then between milkings? So as we said, the first milking and just the first milking is colostrum, and then milkings 2 to 6 are called transition milk. And when we look at the difference between the first and second milking, we can see that the antibody levels have reduced by over half. And if we put in our threshold line there, we can see the second milking doesn't come up as far as the threshold line. But there's still valuable information here that if we look at the second milking compared to milkings 3 to 6, we can see the antibody levels are far higher in that second milking. So if you can even separately collect that second milking, it's really advantageous, and then feed that to the younger calves because it's going to convey that greater immunity to those calves. And another question is there a benefit to feeding transition milk? And the simple answer is yes, that there's big health benefits. It leads to improved health and immunity. So although there's gut closure after 24 hours, it can line, the transition milk basically lines the gut and can prevent scours. If you're vaccinating cows for rota or for crypto, you need to feed that transition milk for a sufficient amount of time to ensure that you're conveying that immunity. The calves are getting the antibodies against those like the rota and the crypto. Feeding transition milk can also lead to improved growth and feed efficiency. And then you have to question like an economic advantage. Like if you don't feed the transition milk, what are you going to do with it? Are you throwing it out? So there is, it's a useful product that should be fed to the calves and will help promote their health. And if we look at this, the concept of this window of susceptibility, what we're seeing in the red line there is that when calves are fed their colostrum, their passive immunity spikes there at about 24 hours old, and then that starts to wane. But at the same time, their own active immunity is starting to increase. But there's that high risk period in between when, they're maybe 2 weeks older that. And if we're feeding them transition milk during this period, that's going to be of advantage to them. So the take-home messages are colostrum 1, 2, 3. So first milking, feed within 2 hours of birth, feed 3 litres. Hygiene, make sure everything is really clean. The equipment that you're collecting the colostrum with, the equipment that you're feeding it with, and if you're storing it, that you're storing it within 3 hours. And to feed transition milk for as long as you can. Okay, thanks for your attention.
Brilliant. Thanks, Emer. And I'm realizing listening to you that we really set you a challenge trying to cover all these key areas in 10 minutes. So thanks for sticking to that. And just while Liam is setting up there, you did a really good job of kind of summarizing the key messages there. And I think it's always interesting to hear about the interval and the importance of from when they calf to when the cow is milked, and how that deteriorates, the quality of the colostrum reduces. So that's probably something we haven't heard too much about, and it's good to re-emphasize that. And I thought it was interesting about the variation in colostrum quality that you've seen across farms. So again, that's a huge thing that we probably a lot of us can improve on. So are you able to share your slides there, Liam, or do you need Jenny to help, or how are you going? The immunity graph was also important. That's the kind of to highlight the key risk period there between when the passive immunity is dropping before their own immunity kicks off. So thanks a million, Emer.
No problem.
And I just encourage people to type in the questions if they have them. They are all anonymized in case you don't want to be thinking people can see you, and we'll get to them during the panel at the end.
Thanks, Michelle. Thanks, HI. Just what we're trying to do after following on there from Emer is we're trying to develop the room and feeding the calf basically for successful weaning from milk or milk replace or onto solid feed. So we have a big challenge. What we're trying to do over the space of 12 weeks is take basically a single monogastric animal, more or less, with very little rumen development, and convert it into a rumen at 12 weeks of age. We're trying to double the birth weight within 8 weeks, from anything from 32 to 40 kilos, depending on the type of breed, to double that birth weight up to about 80 kilos at 8 weeks of age, and to be grown at an average daily gain of 800 grams per day if we're to successfully calve down, if it's in terms of replacement heifers, to calve down at 24 months or 2 years old. And we also need it to be consuming after its transition milk, 3 litres of milk or milk replacer morning and evening, 15% of body weight. And we need to get it up onto that level of feeding after 10 days. And to get solid feed intake of at least a quarter kilo concentrate at 3 weeks of age if we're going to have a successful transition to a ruminant, and consuming 1 to 2 litres of clean water per day at 3 weeks of age, and eating a kilo of concentrates at the start of the weaning process, and be at 100 kilos weaned and eating 2 kilos of concentrate and plenty of straw or roughage going in there. This is what we're trying to achieve basically from the transition milk onwards. So basically, we're basically talking about a monogastric animal, young calf, where you have the abomasum, or the milk stomach, is the biggest contribution in terms of compartmental tissue at that age. And it's not until we get to 12 weeks of age where we have the rumen basically taken over in volume and size. And it's basically up to basically good esophageal groove movement, which moves the milk, keeps it away from the rumen and basically into the abomasum in the young baby calf. So if we take it from what Emer is talking about in the yellow writing there, the transition milk, if we're vaccinating calves, we're still going to be feeding, definitely for the first weeks of the calf's life, some element of transition milk, feeding anything from 2.5 to 3 litres per feed. And then we're moving on to the milk feed. So what we're trying to do is get them up on 3 litres AM and PM by end of week 2. It's the most efficient time to put live weight onto a calf. Basically, for every 100 grams of feed, we're going to get 50 grams of growth. So there can be a kind of a misnomer or a kind of a feeling out there that the quicker you get a month to concentrate, the quicker. But as you see from the previous graph diagram, is that the abomasum, there is no big massive rumen volume there in the calf under 3 weeks. So to be trying to think that a meal is going to substitute for milk, it's not, and you're not going to get the same terms in terms of efficiency by not putting milk in there. The calf needs to be at least 4 weeks of age really before we consider once a day feeding, because we're not going to have massive amount of rumen activity there if we pursue down that road at before that age. The big thing I tend to notice out there a lot with calf feeders, and particularly with computerized calf feeders, where you might be bucket feeding or 10-teat feeding and feeding 3 litres morning and evening whole milk or milk replacer. There is a tendency with some feeders that when they're making the transition from transition milk onto milk replacer, to pull the volume back first, anything from 5 litres to 4 litres, and then to gradually step it up again over the space of anything from 7 to 12 days. So there is a period there. You want to be careful if you are looking at your feed plans on feeders, that you're not pulling your calves back too much from where they were on 3 litres of whole milk morning and evening, and suddenly dropping to 4 in a very cold weather in the likes of February. Your calves can be under pressure. The main thing then is when we're talking about if we're trying also then after that is to have the weaning period over 2 to 3 weeks, and ideally over 3 weeks if we can. There is issues again on farm where we're getting somewhere scoured. It's not all to do with the transition onto solid feeds, but where cows are being weaned abruptly, it can be a contributory factor towards cows not able to handle grass and fibre when they go out because they've been pulled too quickly off milk. But the final ones on that end, if we're buying in cows, we're generally buying them in at 3 weeks of age, 50 kilos in weight, and again they're going to be fed anything 3 litres morning and evening, again from anything from 5 to 6 weeks. And then once a day feeding, you've 2 options. You can either double the concentration, or what you can do and feed 600 grams in 3 litres, or else if you're just an ordinary 10-teat feeders, you're basically coming down from 375 grams in your 3 litres in the morning, and you're basically going to drop that then down to 2 litres and basically finish it out over 2 weeks. And again, that's if we're talking about rearing heifers or you're finishing cattle, basically what we're trying to do is double our birth weight at 8 weeks of age, and basically have the calf at 80 kilos. And again, we need those, if they're hit their targets for 2 years, they need to have them at 56% of mature body weight. So we need to be up at 360 kilos at 13 months. And again, depending on the mature body weight of the actual cow itself, anything from 550 to 560 kilos, basically at first lactation. And if we're calving them down at 24 months, 70% of heifers we're managing to achieve with that. There's still 30% of heifers don't calve down at basically 24 months. They're calving down at 29. So the heifers that are calving down at 24 months, they're coming into profit. They're in their second lactation. Halfway through their second lactation, they've covered the costs. Whereas those calving down at 29 months, it's going to be into their third lactation, even if they survive before they actually give a return. Again, if we're talking about feeding the calf to develop the rumen, basically of the milk solids that go in there, the 750 grams of powder, 3 litres, all the morning feed of what a calf needs goes to keep the calf breathing, to keep the calf warm, and basically to cover its immune system. As Emer says, it doesn't have an immune system when it's born. It has to absorb the antibodies and the period of time build up its immune system. So the calf is challenged, and the newborn calf needs to be somewhere when it's lying down in the calf shed. It needs to be about 15 degrees. Otherwise, it's burning up energy trying to stay warm. And only what's above that 380 grams can go into basically provide growth if we're trying to hit our target weight of 750 grams a day. So the more pressure we put on that by having damp, wet straw under the calf, having drafts in the calf shed, or with very cold weather, more and more that 380 grams is going to push up into the 750. We'll have less for growth for the calf at the young age. So again, depending on if we look at traditional systems, we went back 8 or 9 years ago, we were basically talking about 500 grams average daily gain on a calf, which is 10% of body weight. And in the last number of years, we've stepped it up to 15% of body weight, 750 grams a day. Some people, basically, depending on what they're trying to do with these high genetic merit herds or accelerated growth, they'll be pushing for higher weight gains. They'll be feeding 900 grams a day average daily gain is what they'll be targeting. And you've 2 ways of getting your growth rate in your calf. One is you can feed your mixing rate at 125 grams, feeding 6 litres a day to give you your 750 grams average daily gain or intake of powder. Or else you have the option, depending on, that's fine with feeders, with 10 teeth feeders, and that sometimes to get bigger volumes in can be more awkward. So by upping the concentration to 150 grams a day, and again feeding at 6 litres, you can get 900 grams in, or the equivalent on the other one. You can feed 5 litres at 150 grams and still get your 750 grams of solids in. The main thing is if you're up in litres to calves, solids can be an issue with calves under 3 to 4 weeks. If the concentration is too high, you can cause problems with abomasal bloat, where the concentration is just too high going in. It stays too long in the abomasum, and it allows bacteria time to grow and can cause issues with bloat. So whether it's litres or volumes, it's important to try and get the balance right. And again, kind of conclusion parts of feeding the calf again for developing the rumen. Nutrients are required for maintenance, as we said already, and initially it must all come from milk. And again, we're just showing the previous slide. For higher growth rates, you need more energy, more protein than traditional rearing systems. And the weight gain will depend on the quality and quantity of the feed consumed. And again, that's if we're using whole milk, or if we're using 50% skim milk replacers or whey protein concentrates, those type of ingredients are more digestible, as opposed to some products where we're using more vegetable type proteins or cereal type proteins included in some milk replacers. And likewise, the qualities of your starter rations, the more digestible it is to the calf, the greater again consumption is going to be, and the greater weight gain will be from that.
Thanks a million. That was really interesting. And it's good to re-emphasize the key targets that we're trying to achieve, and the how much we're asking from calves to have their rumens properly developed. So Catherine, you're ready to go. Brilliant. Thanks a million.
Okay. I guess I will whiz through a couple of slides. I guess we all know the importance of calf health, but I do think it's important just to maybe flag a couple of recent stats. That 1 in 5 Irish dairy replacement heifers alive at a month of age never calve. So that's very recent data. from the last couple of years. And as Liam's already mentioned, only about 70% of those heifers that are calving in the target age of 22 to 26 months. And we know we have an issue with wastage. So, from an animal that calved in 2023 for its first lactation, we know only 85% of those made it to lactation 2, and only 65% made it to lactation 3 last year. So this is all very recent data. And we also know that we have a reasonable leak in the system between 6 weeks of age and a year old. When we think the hard work is done, there's reasonable mortality there. And without doing loads of research on that, we know that respiratory disease is a big factor. So I guess just setting the scene that, obviously we need our animals to reach age and weight at slaughter, age at breeding, etc. But how do we get there, I suppose? So the targets, I think these key performance indicators ideally would be farm dependent, and mortality is one. Obviously we want that figure to be 0. But we certainly want it as low as possible, below 3% in our pre-weaned calves. Ideally, over 5, there's an issue. And each, there can be years with extreme weather events or a big outbreak of disease or whatever. But in general, we want that trend to be as low as possible. We want morbidity. So basically, that's a measure of treatment. So treating for scour or pneumonia, ideally, we want to be treating less than 15% of the calves for that. And how do we measure this performance? Ideally, we need a birth weight or some average of birth weight to see how animals are growing. And Liam has mentioned it there in terms of trying to get a reasonable average daily gain. 0.7 kilos per day is maybe not realistic for some of the, smaller, very smaller Jersey calves, etc. But for the vast majority, it will be. So I guess it's just thinking about having some sort of sensible handle of what are they actually doing. We don't need to weigh calves every week, but we need a handle of birth weight kind of between birth and weaning and weaning to see what's going on. And I think just to kind of go back to the first slide there on the wastage piece, that's important because a lot of the issues when animals aren't making their weights for breeding and then subsequently for first calving, that's often a reason why they end up getting culled out of the system and everything that goes along with that. So there is a real kind of focus now on young stock because we know, and as Emer has mentioned as well, what we do with them in the first days and weeks of life has a long-term impact. So we can go to ICBF and find our stock reconciliation report and look at last year's performance if we want to start there. And different treatment records will be available. So I guess if we wanted to look back at last year. But looking forward to this year, I suppose a quick review of the scour and pneumonia, which is all I wanted to squash in. I think there's nothing really new in this area because it's the classic calf diarrhea, calf pneumonia between birth and weaning are classic multifactorial disease outbreaks. So what we mean by that is for a disease to occur, it really has to be a collision between what's going on in the animal's immune system, the factors of the bug itself, and what's going on in the farm environment. So, Cryptosporidium rotavirus are the 2 leading causes of calf diarrhea across the world. Most farms have them. Some farms get issues, some don't. And it's these other modifiable risk factors, like possibly the calf's immune system or the environment, that might be the difference. So disease occurs because of this kind of collision of different things, and it is not solely related to the bug itself. And the same goes for pneumonia. Nothing terribly new. We know that there's a whole suite of bacteria and viruses that like to infect calves, many of which the cows already have. So whether we see disease or not is more of these kind of mix of factors. So as I said, I'm not going to dwell too much on scour and pneumonia. I think people know exactly what it looks like, unfortunately. And I just want to look a little bit about if kind of speed forward, if you were to find yourself in an outbreak situation, what kind of things can we do? So any infectious disease, whether it's cell count or lameness or calf health, whatever is going on, we look at 2 pillars, which is to try and promote the animal's immune system so they can fight it off and try and do everything we can to make sure they meet as little as possible of the different bugs. So what does that actually look like? So in terms of calves, These are things like standards of hygiene, and hygiene is a very broad word, but we're talking about the calving pen. If we are running into issues, that's the first place the calf lands, and as John has mentioned, that real importance of the first hour. Is there anything we can do there in terms of if we do see scour and pneumonia problems, well, particularly scour, in terms of can we clean it out more often? Can we keep it more dry? The same for the calf pens. You know, is there anything we can do? Are they stocked okay? Drainage, all of that. Hygiene also goes for feeding equipment because, you know, for certainly some of the respiratory pathogens like mycoplasma, for example, the feeding equipment can be a real vector. So looking at, can we do anything to reduce exposure? Are we rotating teats on automatic feeders? Are we cleaning the teat feeders on properly? That kind of thing. We also need to look at animals when they get sick because the horse will have bolted at that point when we have 3 and 4 with a high temperature or scouring or whatever, and really kind of promptly and effectively trying to treat them because that might help us reduce the infection load to the others. Liam's alluded to this as well around the idea of cold stress in the younger groups, particularly under a month of age. Cold stress calves become sick calves. So if they're only having enough feed to keep them alive, they don't have enough also to keep them warm, and that's a big thing. We look at also things like, is there an appropriate stocking rate? Is there anything in the house that we can do to try and minimize the amount of bugs that they meet? So that might be, is there anything we can do around air quality, drainage, matching of groups, that kind of thing? And, you know, feeding the youngest calf on the farm first, kind of sensible things. I'll mention that again in one more slide's time. For the immunity piece, it's really all about the colostrum, which Emer has covered in detail, but also about how much we feed them, because as Liam's mentioned, really what we feed them makes a big difference to the function of their immune system. Also things like calves love routine, so they don't like changes in temperature of feed, different times of the day, that kind of thing. And is there anything we can do around husbandry, that kind of prompt treatment, etc. And obviously then sensible vaccination plans. Just to put that into an actual scour outbreak, you know, regardless and independent of whether it's crypto or rota or both, things we can do, you know, and this is very broad terms. Obviously, you know, we need to engage with our vet and figure out which it is, because there'll be slightly different approaches to, you know, managing the calf. But broad terms, whether it's scour or pneumonia in terms of an outbreak, we chase marginal gains in colostrum management. Can we collect it quicker? Can we get more in? Is it being stored? That kind of thing. Can we feed them more? Is there anything we could do? Maybe change our wash routine, that they get the feed buckets, get a full wash and disinfect once a week, but they're getting a hot wash once a day. Is there anything we can do to kind of interrupt the infection? So I know it's impossible or almost impossible in a seasonal system to really kind of isolate in the early phase, but in terms of a scour, especially the way it spreads, that is something that might help, but I realise there's practicalities there. We need to review what we do with the sick calf. So sometimes scour, how we approach that calf, can make a difference in whether they're living or dying. So are we getting the electrolytes in quickly? Are we giving appropriate treatments? And that's really something that we need to discuss with our vets. And in terms of if the farms are getting bigger and bigger, and there's lots of different people involved in calf rear, and it's always good to make sure everyone's on the same page about things like that. The same for the cleaning of the utensils. If you don't have a problem, you don't need to worry about this. But if you are having issues with scour or pneumonia, then we look at exactly the detail of that and is there improvements to be had. I've mentioned treating sick calves last, feeding the youngest calf first. We might look at reducing access to a calf pen, proper disinfection on the way in and out. And there obviously is some sensible cow vaccinations for scour pathogens that would be worthwhile considering if you have a history of scour. It's late for February coverage now, but certainly for the later ones. And things like housing. Is there anything we can do to improve drainage, keep the calf warmer, more straw, block drafts, all of that? Very similar principles in terms of if you were to be unfortunate enough to run into issues with a big outbreak of pneumonia, or even any kind of an outbreak where we're treating any kind of appreciable number of calves. The same idea around, are we feeding them enough? Do they have enough colostrum, etc.? And again, this is an important one for how are we treating them? Are we getting in the anti-inflammatory, the correct antibiotic, dealing with our vet and making sure that that's all correct? And then the environment, I guess, we know that pneumonia viruses come first, bacteria come second. But also we know now that with the advent of further research that lots of environmental risk factors do the same damage to the calf's respiratory immune health as the likes of an RSV or a PI3 virus would. So cold stress, drafts, poor air quality, high ammonia, that kind of thing can all impact respiratory health. So is there anything we can do, keep them warmer, jackets, block out drafts? Is there anything we can do to improve air quality? So promote, realistically sheds ventilate with the wind effect in most houses in Ireland. We can't change the site of it or the width of it, but can we do anything to improve the airflow? Is there anything we can do to improve the drainage, whether that's cutting channels, slope, etc.? Reducing stocking rate, obviously dilution is always a good answer in terms of an outbreak. Not doing group changes or anything around the same time as weaning or anything like that, and then a sensible vaccination strategy. Those would be the kind of things, regardless and independent of the pathogen, if we can chase the detail there, that we might actually help control if we end up in a situation where we have to treat loads of calves. So just to conclude there, we've heard colostrum is the be all and end all. Calves love a bit of consistency. We do want to make a feeding and weaning plan and make sure we're feeding them enough, particularly early. We want to look at any potential control or modifiable risk factors in the environment to improve things. We do want to engage with our vet to tackle problems early and get the most out of the proper vaccines. And if hopefully things are going well, we don't need to change. But these are possible considerations if we do find ourselves in a scar or pneumonia outbreak.
Thanks,
Okay.
Catherine. Brilliant. So we have time for a few questions. Thanks to you all for keeping the time there. Yeah, we have a few there. I suppose there's one in there, and it's about feeding rates for calves. He's buying in the calves at a month of age, and he's giving 12 and a half. I'll just read it because so I'm not saying it. He's giving 2.5 litres twice a day at a 12.5% concentration, and he's wondering, is that enough? Or they're wondering, is that enough? Is there any way we can simplify this for people to make it easier to understand? Like, I know it depends on what weight the calves are and what size, but like, so how much powder is he giving there, or is that enough? I don't know who wants to take that. Liam, probably you were talking about powder and rates and stuff, but I suppose just there is probably it does depend on the calf size and the concentration, but is there any kind of easier way of explaining it, maybe in terms of volume of powder that they're feeding?
Well, if I'm reading you right, if I'm reading what you're saying, Michelle, it's 2.5 litres morning and evening. He's only so he is a bit short there. Like the calves will be fine. He's probably hoping to a fair degree. They're 3 weeks of age. They're going to start taking in concentrate. But
yeah, they're a month of age. Yeah.
In terms of as I said to you, in terms of food conversion efficiency, he will struggle. Like this is the month of February, and temperatures are down at 7 or 8 degrees. He's short, whatever way you like, at 100 grams there.
Okay.
And like if you're talking about most efficient I'd put live with on now, is he would be paid. He'd be better off to step it up to 3 litres at 125 grams.
Oh, at the same. Yeah.
At 125 grams, he needs to be at this time of the year,
And that works out at 750 grams of powder a day.
Yeah, 375 grams with his 2.5 litres of milk in the morning, and 375 grams and his 2.5 litres of 2.5 litres of water in the evening time, to give him 3 litres of mixed milk morning and evening at 12.5%. He needs that at this time of the year. They're still not going to be taking in enough concentrate for what the milk will do for him,
And you have that on your slides there anyway, and we will be sharing the slides after as well, because it is a bit confusing. But there was a question for John there at the start about is there any effective technology for monitoring cows that are calving, or that you're aware of, or any advice?
Yeah, there are, Michelle. The traditional way of monitoring, of just observing it, is still a super way to monitor cows at birth. But we do have available temperature sensing devices, tail monitoring devices, activity measuring devices, rumination devices. So there are multiple different options available to monitor cows at birth. And if farmers are not familiar with them, have a chat with their vet, who will have experience of going to calvings where farmers have used these devices, chatting to farmers about what they find good and bad about them. Because there are pros and cons that can be costly. They can give you false alarms, negative alarms. They can drop off cows. They can cause infections if you put them in wrong. So something to have a chat with your vet about if you're interested in pursuing it, but lots on the market, yes.
Yeah, and that's probably a good point to reiterate. We're not trying to stop or prevent you from having a chat with your vet, because that's kind of, we're trying to cover a lot of topics, but if you want more detail, it's probably better to talk with your vet, especially at this time of year as well. Yeah, so there's a question there. It's about vaccinating. Some farmers give a product 8 ml per day for 7 days. I think it's to prevent crypto. Would you recommend? I guess I'll hand that over to you, Catherine, maybe.
Yeah, so I presume the product for crypto prevention is an oral antibiotic or paramycin, or some.
It's Garbro Vet Multi-8, which
yeah. So, look, I guess, I mean, there is a whole argument around the need to give oral antibiotics to calves. We probably should not be doing that for good practice. However, it is currently licensed in Ireland. It's licensed for use in treatment of or prevention of E. coli or crypto. If you've had issues on the farm, I guess the reality is then, and if it's done under advice by your vet, then fair enough. Should every farm need to give it? I would think absolutely not. But in terms of on a case by case scenario, then it's something to consider. It's there, particularly if you ran into an issue.
And with crypto, I guess it's all about the colostrum management, which we've talked about, and hygiene, disinfection in between the seasons as well. There's no quick fix really, is there?
No, and I suppose that the big thing about crypto is that you can stuff them with colostrum, but even if it's there and build, it's going to ramp up in numbers quite quickly. It's on every farm.
Yeah.
Cows are shedding it in their dung anyway, even healthy cows. So you're getting a build up over time. So it's just kind of about that kind of careful balance. But there are those other tools, as mentioned there, if you do end up in an outbreak scenario.
Yeah, very good. And as I say, we will share the slides in the email after. And there'll also be a feedback survey, actually, which we'd appreciate if you could fill out, because it gives us a better idea of what we need to present on in the future. We're kind of nearly at the time there, and there's actually a good few questions. So I think we will follow up with a list of questions after. But just, there was kind of one thing we're always asked. I guess we have a BVD eradication program in AHI, and I just wanted to kind of reiterate the key advice for this year is to tag your calves as soon as they're born and send the samples off. And if they are positive, to get rid of them. I know it's dragging on a bit now, but we're near the end. One last push, and we will make it. It's always harder at the end of an eradication program, but we do all need to work together to make this happen. So just try and do your best. There's only in 200 herds now, so it's a very small portion, so we don't want to let that slip. I guess we might just leave it there, and we will follow up, as I say, with an email with the resources, with the list of questions that haven't been answered. I just really want to thank all our presenters for their time and efforts today. There's a lot of work goes into these webinars, so hopefully you found it interesting. The link will be shared. It will be available on the website anyway. But as I say, we will be in touch, and best of luck for the calving season. Thanks very much.